Hey folks, Doug Blake with Body Design University. In this video, I'm going to talk to you about an exercise called the upright row. Now stop for a second. Hang on. I know if you have watched any of the videos that we do here at Body Design University, or even been to our live course or do the online course, I know what you're saying. That's one of the no-go exercises, Doug, and you are absolutely correct. I don't recommend doing it, but I will say this, no matter how often I tell trainers not to do it because there's better things you could be doing, they still do it. And so to help out those trainers that persist in doing upright rows, let me give you a couple little tips. If you're going to do it, how to minimize the inevitable. And when I say inevitable, I'm saying it will happen over time, the inevitable or minimize the inevitable damage that will occur if you are doing this type of exercise, even in the best possible biomechanical form, because you're using loads on those particular muscles and producing the compressive impingement syndrome that inevitably occurs. I do want to give you a couple of tips on how to minimize those risks as best I can. But first, before I go into that, please, if you would, and you haven't done so already, go ahead and subscribe to our channel, hit the notification bell so you know when all the new content is coming out. By the way, also, go to the Facebook page if you haven't been there, into our private group, and check out all the great content and activity that occurs in there. Okay, so now back to the upright row, which, like dips and all these other crazy exercises that are going to, and you'll hear what I'm saying, going to cause problems. Resistance training, just in general, is going to probably cause some, quote, damage or injuries to the human body. It's simply not, we're not well designed for that. With that said, of course, we're going to use resistance training, and of course, we're going to exercise. That's not the issue. The question is are there exercises that are, by their very movement patterns, creating an unnecessary level of risk to the joints, connective tissue, soft tissue, yada, yada, yada? And the answer is yes, of course. However, even with those exercises, like, yes, you heard me say dips, leg presses, behind the neck pull downs, and behind it, all of those movements can be modified to make them less risky. So that's why I'm talking about the upright row, because it's inevitable. I get students that are trainers, or trainers that become students, always asking, man, I love upright. They're asking me, can I do something? Because I love doing upright rows. I really feel it in my delts and my traps. And the answer is, yeah, sure you can. Of course we can do it. And that's what I want to give you some ideas on. The first thing, number one, is that when you do an upright row, irrespective of how you're doing them, you can use dumbbells, you can use generally a barbell. First most important thing is the positioning of the hands, how close or how far apart they are. And always keep in mind, the closer the hands are when you do it, the worse it is, the greater the risk of what we call shoulder impingement syndrome. You may have heard subacromial syndrome, something like that, because impingement syndrome is the issue. Okay, I'm just throwing it out on the table if you want to Google it and see other YouTube videos on the animations, and some of them are pretty cool, by the way. It's called impingement syndrome, and it's when the tendons, the soft tissue that are located in the rotator cuff, we call these things the rotator cuff, and in particular the supraspinatus tendon. You may see the long head of the bicep tendon, which is also, if you talk to doctors, and I've spoken to many of them, physical therapists, these are the individuals that really know about impingement syndrome and how to deal with it. That's what we're dealing with when we do an upright row. And the problem that we face with the upright row is not just the fact that you are abducting. So this is abduction at the shoulder. So that causes its own issues. And by the way, the higher you abduct, in other words, the higher you lift your arms up overhead, the more risk there is of creating. But by the way, that's repetitive. But here's the thing with the upright row. Impingement syndrome is the issue. Well, guess what actually exacerbates the risk for impingement syndrome? It is internal humeral rotation. And guess what you're doing with upright rows? Internal humeral rotation. So combine internal humeral rotation with abduction, or lifting the arms out to the side, and you have significantly increased the risk of impingement syndrome. And that is the one reason why I say, I don't care how you do them, and you can do them like I'm going to explain to you to reduce the risk. But at the end of the day, why do them? Why do them at all when there are other great exercises to train your deltoid? And so the risk is just unnecessary. But again, as I said at the beginning, I'll give you some ideas on how to minimize that. Well, when all is said and done, if I can minimize the inevitable, you have to internally rotate. I don't care where your hands are. It's just worse when the hands are closer together. So the recommendation is to reduce the risk of impingement related issues, impingement syndrome, because of position of hand. Just move the hands out. The further out, the better. So in other words, if you're going to do an upright row, don't do them like this. This is the worst way to do them, because that is maximizing internal rotation. But what you'll notice is, take a look. Okay, well, I'm wearing a shirt. But if I move my arm out, I'm actually going to reduce the amount of internal rotation. You're still internally rotated. You get that, right? There's always a risk. You reduce the risk by going further out. So if you must do upright rows, I don't know why you're doing it, but if you're going to do them, please do them with the arms, with the hands further away. Yeah, I used to do upright rows because I hurt my shoulder, right? If you know me, anybody knows my story. I don't have an AC joint. I had it removed because I trained incorrectly for many years in athletic events. So I would go further, and the further out, it didn't hurt as much. So upright rows performed this way are safer. I didn't say safe. I said safer than upright rows like this. That's number one. That's the first most important thing. The second really critical thing is, how is the angle of abduction, or how high up are you bringing your arms, i.e., moving those elbows. That's the other critical risk element here. And again, if you're going to do them at minimal risk, you don't lift the elbows very high. You get the idea. So the higher you lift, i.e., the greater the abduction occurring at the shoulder joint combined with this internal rotation, the greater the risk for shoulder impingement. Do it over and over and over. Look, you can get an acute injury just from doing that, especially if you are throwing it up. And look, this is why power cleans and snatch clean and jerk, things like that, are potentially problematic. And that's why they produce the injuries that we see in even the top level athletes. Okay. So the point is that you can't lift it very high. If you lift it to I don't know, maybe to like your abdominal rib cage, bottom of the sternum area, somewhere around there where the elbows, if you look at the elbow position, doesn't go much higher than my shoulder, you have minimized the risk. I hope that makes sense. Basically, the third thing, so you get it. First, hands wide. That reduces the risk. Second, don't go up very far. That reduces the risk a little bit. And the third thing, which is really subtle, and most folks don't even realize it when they're doing this, but it's the relative position of protraction or retraction of the shoulder girdle. It's also really important. And if you're going to minimize the risk, you need to be in a retracted shoulder. The shoulder girdle should be retracted. In other words, you pull your shoulder blades behind you. Okay. So now you got three things, right? You wide, don't go up very high, and lift up the rib cage and pull the shoulder blades back. Now, with that said, you have just essentially limited your range, your effective range of motion, to really work the deltoids and even the trapezius. So my question to you is, why are you asking me to do these things correctly. There's no correct way. There's no correct, safe way to do it. Okay. There are only less destructive, risky ways to do it. But those are your three elements to keep in mind if you must do upright rows. See, there it is. Don't do them. I just recommend you don't do them. They're unnecessary. It's an unnecessary exercise. You've got lateral raises. You've got so many variations of lateral raises, so many variations of shoulder presses. You can spend the rest of your life doing those two movements. So I don't recommend upright rows at all. But if you must, remember those three things. What are they? Hand position wide, right? Don't go up very far. And retract the shoulder blades, right? Retract the shoulder girdle, pull the shoulder blades back and lift up the rib cage. In that case, you probably have to lean forward slightly, but that movement of the rib cage that pulls the shoulder girdle back will give a little bit more room for the acromion to kind of have some release or openness when it comes to the compression nature of the acromion and then the internal rotation of the humeral head. Because remember, the head of the humerus up in the glenoid, right, has these bony protrusions, and that's where this compression element comes in. We call it impingement syndrome. There it is. Look, if you understood what I went over today, please type the word understand in the comment section below. If you're interested in becoming a certified, but more importantly, qualified personal trainer, then for sure, click on that button in not the button, but there's a link in that description box below. Click on that, talk to one of our admissions advisors, and get on board with Body Design University. Have a great week. Just let us know if you got any comments or you want more content like this. We're more than happy to help out. Take care.